Good evening and welcome. I'm Frederick County Executive Jan Gardner, and we're very pleased to have Congressman Delaney with us this evening to host this workshop on heroin and the opioid crisis. I do want to acknowledge some local elected officials who are in the room this evening before we get started. I want to start off with Senator Ron Young, Delegate Karen Lewis Young, and then from the County Council, we have three council members here, Councilman Jerry Donald, Councilwoman MC Keegan-Air, and Councilwoman Jessica Fitzwater. So thank you all for being here this evening. I do want to share and make a few comments of welcome and also to tell you a little bit about what we're doing on the county level. The heroin opioid crisis is indeed a devastating crisis that is affecting citizens of all ages, races, genders, and income levels. It's affecting our rural areas, our suburban areas, and our urban areas. From January 1st to July 2nd of this year, the first 6 months of the calendar year, Frederick County has experienced 142 non-fatal overdoses related to heroin and opioids, and sadly, 26 fatalities. These are lives lost to this epidemic. The combined total of overdoses in Frederick County stands at 168 for this period of time, and that's a pretty sobering statistic. To translate what that means, it means that someone in Frederick County, on average, every single day overdoses from heroin or an opioid. And every week, a life is lost, and that's right here in Frederick County. In the state of Maryland, more people are dying from overdoses than are killed in car accidents or by homicide. In 2016, there were over 2,000 fatalities in the state of Maryland. Drugs are tearing families apart, leaving a wake of destruction. And it's not just the people who are challenged with addiction that are affected. It's certainly their families. We hear of young children in our community who are neglected, sometimes left without food and other basic needs because their parents are addicted. In fact, we've even had young children call 911 asking for assistance because the baby was crying and somebody needed to feed the baby and they couldn't wake their parents up. So this affects a lot of people, and it's a big problem, and there's no easy solution, and that's why a forum like this is so important. Our community has taken action, and we know we need to continue to do more. 2 years ago, I formed a heroin consortium to bring all of our partners together. It was law enforcement, government agencies, community advocates, our nonprofits, the hospital, and some others, to make sure that everyone was communicating and sharing ideas. The health department has really done a lot. They've trained about 2,000 people on how to administer Narcan, which will effectively reverse the effects of heroin and prevent death from overdose. The health department has trained law enforcement officers, firefighters, paramedics, family members, and general community members. Narcan has saved more lives in Frederick County than we've lost to heroin this year. So without Narcan, the statistics would actually be significantly worse. The health department has also trained peer recovery coaches, and these are people who are doing an amazing job of helping to connect people struggling with addiction with services and resources they need. Peer recovery coaches have been embedded in the emergency department at Frederick Memorial Hospital for the past 2 years, and they've connected about 78% of the people they came in contact with some kind of service. And at the Adult Detention Center, the Drug Court, and Parole and Probation, peer recovery coaches have been in place since last August. And they've also successfully connected about 75% of the people they've touched with services. Recently, our health department received a grant to evaluate and determine whether it was a good idea to develop a syringe exchange program. And our school system is identifying ways to raise awareness in age-appropriate ways. In fact, the state legislature passed a bill this year requiring our education system to expand their existing drug addiction and prevention education programs to include heroin and opioids, to establish a policy and to store Narcan in all of our schools, and to establish a community action official program to coordinate school-based community forums. The health department has also launched a compelling and award-winning campaign called Take Back My Life, which is videos of people in our community sharing their struggles and, more importantly, their success in combating addiction. And you can still find those videos at takebackyourlife.org, and I really encourage you to watch them. Again, it's takebackyourlife.org, and share them with your families and friends. The Heroin Consortium recognizes that prevention and outreach are just part of the solution, and that raising awareness is very important. So with private funding from a number of our advocates, we've erected a billboard showing the number of overdoses experienced in Frederick County, and that's been unveiled. It's on Route 85 in front of our Adult Detention Center. People need to know about it. They need to talk about it in their families and in their community, and know that this is happening right here in Frederick. Many grassroots efforts have and continue to evolve in our community: the Maryland Heroin Awareness Advocates, the Richard Carbaugh Hope Foundation, and the Up and Out Foundation, to name just three. These groups and others are working diligently to help get the word out, to help families, and they're really helping to work with our government partners to prevent or intervene with loved ones who find themselves in the throes of addiction. In the next few months, we have more outreach planned. We plan to have a keys game where members of the Heroin Consortium will be passing out literature. September is National Recovery Month, so there'll be a number of events, including an artist journey to recovery at the community college and a summit that focus on addiction, adverse childhood experiences, and domestic violence. I don't really want to talk for a long time, but I could really talk longer about what we're doing. But in Frederick County, we do want people to realize that this is an issue that affects people in our community from all backgrounds and all walks of life. If your family has not had to cope with an addiction, chances are you know somebody who has. So to Congressman Delaney, I say thank you. Thank you for facilitating a community conversation about this epidemic. And thanks to all of you for being here. It really is time to talk openly and honestly about heroin and opioids. It is a community issue that demands community action. So thank you very much. There is help and there is hope, and I look forward to hearing the panel discussion.
Well, I want to thank you, County Executive Gardner, for your singular leadership on this issue. The citizens of Frederick County are fortunate to have you in the position you're in. You bring great compassion and ideas and insight into this issue, as do the other members of local government who are here with us tonight, and I want to thank you all for joining us. And most importantly, I want to thank you all for being here and being in attendance this evening and joining us as we convene a discussion on a, unfortunately, gravely serious matter that is affecting communities all over this country. The statistics that County Executive Gardner just relayed to you, those statistics could be scaled up and down in every county in this country based on its population size. This is truly a situation that is affecting all corners of our country. It is destroying families. It is destroying the lives of human beings. It is putting children on a terrible trajectory for the rest of their lives in many ways, based on the repercussions of this. It's destroying communities, affecting school systems, straining law enforcement, who is really on the front lines. I also want to acknowledge former Chief Dine, who I think I lost you here somewhere here, Chief, thank you, and other members of law enforcement who are here. They're on the front lines dealing with this. It's overwhelming our public health systems. Organizations that were set up to deal with similar public health crises are being overwhelmed with this. It's truly, by any measure, one of the great public health tragedies of our country. And there are many reasons this has happened, and we could all go through them. There are economic reasons associated with what's happened to so many communities in this country that created the environment for something like this to spread like it has. The pharmaceutical industry, in my judgment, should be held accountable. They understood the power of these drugs. They understood the power of these drugs. They saw the statistics of how quickly these things were spreading. I think the physician community could have done a much better job in prescribing and understanding the potency of these things. And we didn't have the public health infrastructure, and that's coming under strain recently. So there's much to talk about, and that's what we're here to do this evening. And fortunately, I'm joined by 4 experts who will contribute to this discussion from very different perspectives, but each of them has a lot to add. And so I'm very thankful that they're here. I'm thankful that you're all here to engage in the discussion. Our format this evening is I'll chat with each of our speakers for 10 minutes, roughly, give or take. And we'll go through all 4 of them. And then we'll open up for questions. So if you'll bear with us a little bit, we'll get to your questions and call it 40 to 45 minutes, roughly. And then we'll hopefully have a good, engaging discussion. I know you'll learn a lot from our 4 speakers who are here. So our first speaker is an associate professor at Johns Hopkins University in the Bloomberg School of Public Health, which is obviously a world-class singular institution in dealing with this. So we have great insights. So Dr. Brendan Solinar is here with us. So doctor, I'll keep it a doctor. That'll be easier for me. If you'll join me up here. Thank you. If we don't trip you first. So have a seat. So again, thank you for joining us, doctor, making the trip from, you live in DC, but you work in Baltimore, so there's a bit of a triangle here. And I know you have good partnerships with the county here, so we'll talk about that in a minute. But maybe we could start at some of the almost basic kind of pharmacological levels, if you will, of what's happening here, because sometimes we get into a discussion on this topic, and because it's hitting us so hard that we skip over some of the basics. So why are these drugs so powerful and so addictive? Just give us a little bit of understanding of what goes on from kind of the basic chemistry of these drugs.
Sure, and I want to start off by, of course, thanking you for having me here tonight. I'm really excited to be here in Frederick with our partners, the Frederick County Department of Health. So really delighted as well to be working with all of you. To your question about why these drugs are so addictive, really what they do fundamentally is change the chemistry of your brain. So if you have been using opioids over some period of time, your body becomes habituated to them, and you start experiencing feelings of cravings. If you're not using them, then you can start feeling withdrawal. And of course, now what we're dealing with is a public health crisis that has grown much more complex. And the reason why it's grown much more complex, in part, has to do with what kinds of drugs are now on the street. So just by show of hands, I want to know how many of you have heard of fentanyl. Okay, so there's huge awareness in the room about fentanyl, and I think that's a great starting place. In the last few years, what we've seen is that mixed into the drug supply that people are buying on the streets is a drug that's much more powerful than heroin, and that's fentanyl. And unfortunately, a lot of people who are using fentanyl are not aware that they're using fentanyl, and that has greatly increased the susceptibility of people to overdoses and ultimately to these tragic fatalities.
And so just give us the evolution of how it typically starts with someone who becomes addicted. They're typically prescribed an opioid for a fairly basic pain management.
You know, I don't want to generalize too much, but
Yeah.
you do hear stories like, let's say someone had a car accident, they've got a sore back, their doctor prescribes them OxyContin, and from that initial prescription, a person can really start feeling uncomfortable if they're not using opioids, and that discomfort can cause the person to seek more drugs than really is safe for them, and that puts a person on a trajectory where unfortunately they may be very susceptible to dependence, addiction, and overdose.
How quickly does that kind of addictive quality start kicking in?
You know, it depends on a lot of things. It depends on the individual, him or herself. Some people just have a biology that makes them
More susceptible.
More susceptible,
Yeah.
exactly. And it has to do with someone's environment and their context. So I think that it's important to think about these issues not only from the perspective of the individual, but also the community where they're living. That a lot of factors in your life, in addition to your biology, can really amplify your susceptibility to becoming dependent and addicted.
Has there been any good research done in looking at kind of the data of the number of people who were prescribed these opioid-based pain medicines, and kind of with the benefit of hindsight, we look back and say only 10% or 20% of them or 25% of them actually should have gotten the prescription based on, what we would view as appropriate indicators today? Do we have any sense as to how much this was oversubscribed?
Here's where I think the story gets really complicated, and I want to say that this is an issue where there's no simple kind of tagline. Like, I know that a lot of us feel like opioids are overprescribed, and I do think that's true. But it's also the case that pain management is a very complicated thing, and that we have to really understand the needs of individual patients and be able to offer them alternatives to opioids where those are available, because sometimes those work a lot better than
Right.
opioid pain relievers.
Medical marijuana, maybe, or
Absolutely.
other kinds of treatment, yeah. So that's, so there must be, is the field of medicine kind of emerging? And I'm going to come back to kind of what we should be doing in the crisis, but I just want to, since we have your expertise, tease out some of these kind of almost basic medical questions. Is there a evolving sense as to how pain medicine will be dealt with in the future based on what's happened with this crisis? Like, is that field really rapidly changing so that as we think about kind of the go-forward world today, July 2017, are they getting prescribed radically differently than they were 4 years ago, 5 years ago?
Yeah, I want to say a few things on that. One is that the Centers for Disease Control and Prevention, which is the main kind of federal public health agency that's been working on this crisis, has put out some guidelines last year. And kind of the tagline on those guidelines is go low and slow. So there is a feeling like we need to change the way that we're prescribing opioid pain relievers to patients. And what we see from the national data is something that you might say is encouraging, which is that the number of opioids prescribed nationally is going down.
Right.
And the number of people who misuse opioid pain relievers, and this is something that actually is not well known, is also going down. The problem is that we're at this unique moment where the lethality, meaning how dangerous the opioids that people are using, especially if they're buying them on the streets.
The street products.
The street drugs,
Yeah.
correct, is going way up.
So there's like a vintage of people who were addicted through probably loose prescribing practices who are now largely out of the prescription realm, right?
Yeah.
And so maybe the good news is there may not be that next wave of people getting addicted through the prescribing practice, but now but that first wave, if you will, is all out largely on the street at this point.
That's true, although there's also a lot of opioid medicines that are sort of rattling around in medicine cabinets in families' houses, and a lot could be done to sort of tamp down on that supply as well. So there are street drugs that are dangerous, but there are also pills that are still very dangerous for people.
Yeah, there's probably some estimate as to the number that are out there. I bet it's a big number.
It is a big number.
Because in truth, these medicines are also often prescribed in the last days of life, right, for pain management of a person, going through, the final days of dealing with a terminal illness. And you often find the case that then there's a bunch left over.
Well, or just that, you got a tooth extractor,
Right.
you had some dental surgery, you got sent home with 30 pills, and you only needed 6. So what
Right.
happens to the other pills? They
Yeah.
sit in your cabinet.
Yeah. So that's also something that we all have to be very mindful of. We hear those
Absolutely.
warnings all the time, but you're not sure how many people are following it. I know I'm sure be better. I mean, I can think of various times I've had stuff done and they've given me, I try not to take any of that stuff, right? And I'm sure it's still in our medicine cabinet at home. So let's talk about what we should do, right? I touched a little bit on what I think were some of the causes of this, kind of the confluence of the pharmaceutical industry. I don't want to put you on the spot, the pharmaceutical industry. I tend to be very negative on their behavior here, and I don't want to put you on the spot there. But we have the pharmaceutical industry. We have what physician prescribing practices. We have what was available to people when they showed signs. But now that this is getting the attention it deserves, we talk about it in Congress. We've passed specific legislation to provide more funding. We're having a forum here tonight. This is, I think, the third forum we've had on this topic just in my district. I'm sure my colleagues are doing the same thing. There's articles being written about it almost on a daily basis in major newspapers in the country. So what is, if you were king, what would you do to deal with this crisis right now in our country?
You don't want to make me king.
Well, we'll decide if we want to make you king after we hear what you would do. So.
Well, one thing you might like, which I will say, is that Congress is not very popular. I'm sorry to say this.
9% is not popular?
Yeah, right. But I want to give Congress credit for doing some really important things in the last couple of years that folks might not know about. So a big piece of legislation called the 21st Century Cures Act was passed last year. And what that did was it put $1 billion into U.S. communities to do more to expand treatment. Now, right now, there's also a fight happening in Congress about the future of the Affordable Care Act. You may be for it, you may be against it. But what I will say is that we need to have a national strategy to pay for treatment for people who need it. This is not something that's cheap.
So just on that point, Doctor, if the repeals of the Affordable Care Act that are proposed were to go through, how would you assess the effect on our ability? I mean, I have my own view, and it's very negative on what I think these repeals will do to this situation in particular. But you know, I work in a body that has a 9% approval rating, so people take what I say with a grain of salt. You work for Johns Hopkins, which has probably close to a 99% approval rating, so let's hear what you have to say.
Well, a lot of people want to know, is the Affordable Care Act working? And my criteria of working is, are people who need help getting the help they need? And I think that we're not there yet, but we're doing a whole heck of a lot better than we were before. And I see this in national data. So I actually see that people who need substance use disorder treatment after the Affordable Care Act are much more likely to have resources to pay for that care. So that's a good thing. It still means that there's a heck of a lot of people who are not getting treatment who need treatment. So if you made me king, what I would do is do a lot more to pay for treatment for those people who need it.
Yep.
I'm going to stick my neck out here and say that I think we really need to double down on the medications that treat opioid use disorder, methadone and buprenorphine. I can't stress that enough. This is a key part of the solution.
Yep.
And then we need to do a lot more things that are out of the box that are going to make us uncomfortable, but that we have to take a lot of risks because we're not winning this war right now.
Got it.
So, you know, I'm just going to say one thing, which is that there's a lot that we can do to help people who might not be engaged in treatment right now to reduce their risk. And we call that harm reduction in public health. And there's things like syringe exchange. There's things like providing people with safer places in which they can consume drugs. And I want everybody to consider those things because those might be ways that we could save lives.
We have to have an open mind.
Absolutely.
Yeah, great. Well, thank you, Doctor. Let's hear it for you stay here. I think we're going to have all them. So next we have a local hero here, Dr. Barbara Brookmeyer with Frederick County Health Department. Doctor, thank you for joining us.
Well, thank you.
So kind of building on the discussion we've had, you know, give us kind of the narrative of how you've seen this evolve. We'll start kind of high level, how you've seen this evolve kind of through your eyes, truly on the front lines here in Frederick County across the last several years.
Yeah, so I'd say...
Like if you were writing a Washington Post article on how this unfolded in Frederick, tell us what you'd write.
Well,
News Post.
I'd start by saying that addiction isn't something new to folks in Frederick County, to individuals and to families. What is new, thankfully, is the attention to it, also the lethality. But what I'd say is that going back almost 20 years from the health department, we've recognized that there's been a need to support families and support children who are in families where there's someone in the household who is struggling with addiction. And we've supported them in the Kids Like Us program in the public schools and been able to offer a longitudinal program. So we were doing that almost 20 years ago, recognizing the impact that addiction has on families and the importance and the value of supporting families, the children, and then also their parents. So I'd say addiction isn't new, and back when alcohol was the most common associated drug or reason for people going to the hospital for an overdose, people weren't really talking about it. And I still don't hear in all this discussion about addiction, I don't hear much discussion about alcohol, and I think we should keep that in mind. It's not just heroin, it's not just the opioids. Now, we should definitely be talking about heroin, the opioids, because of the lethality that's already been mentioned. That is different. That is new. So in Frederick County, if we just look at the data from calendar year 2015 to the calendar year 2016, we see that the drug and alcohol related deaths about doubled, but what quadrupled were the deaths associated with fentanyl. And in some cases the fentanyl, and then some of those other synthetic opioids that are out there, the carfentanil, which some people refer to as the elephant tranquilizer, that'll kill someone before they have a chance to, in some cases, lift a finger. It's so rapid. And in China, if there are over 12,000 labs synthesizing these materials, they'll just keep making more and more potent ones because it ends up being cheaper for the person selling it. So we won't be able to keep up with the synthetic labs. We won't be able to keep up with it. So we really need to focus back, as has already been said. There's the individual, but then there's the family and the community that all goes together to help make our community as healthy and as well as possible.
So when you said, first of all, thank you for that, and thank you for what you do. When you said the alcohol and drug-related deaths have doubled year over year, but that the fentanyl-related have quadruples, did the other levels stay about the same? Is that the main reason we've seen a doubling?
Yes, so for the 2015 calendar year to 2016 calendar year, I don't have the data yet for cocaine, benzodiazepines, but I would say that we started to see, after many years of cocaine being relatively flat, we started to see in calendar year 2015 the number of deaths associated with cocaine also increasing. I'd say with prescription opioids, our peak year was 2012. It started to go down, or 2011. Then in 2012, for all substances, we started to see a slight peak down, and then it's gone back up.
With the fentanyl.
Yes, with the fentanyl.
Yeah. And so you've seen heroin epidemics historically, right? This isn't the first time we've had heroin epidemics here or in other places. Is just the lethality of this makes it so different?
I'd say certainly the lethality.
Yeah.
But we've, as a country, had addiction is not new to the country.
No, it's not.
The lethality is. What is also new is that people are willing to come out to a meeting like this,
Right.
come out with strangers, come out with the media here and talk about it. And I have to say that it didn't really hit me until we launched our TakeBackMyLife.org campaign, so www.takebackmylife.org campaign, where brave Frederick County residents who have struggled with addiction or in recovery shared their stories, and were willing to share their stories on video, and that you can view those. And I challenge anyone to say, oh, I challenge anyone to say, oh, that couldn't possibly happen to me, my family members, my friends. It's stories of situations that are so easy to relate to. And unfortunately, it is happening to so many people. After that campaign was launched, so many people reached out and said, thank you for telling those stories. Thank you for talking about this. And, I realized then how many more people than what I even realized, who I see every day, are struggling with addiction in their families.
Right. Well, that is the thing about this crisis. It has penetrated a broader kind of cross-section of the population.
It is, and that's important for everyone to recognize. It isn't the stereotype that people might have thought of.
Right.
In the 90s.
No.
Or even in the 60s, but the 90s.
Yeah. And so as you think about this, and with all the great work you're doing to raise public awareness, because that sounds like a big part of your strategy, right? Which is to just make sure we're doing as much of this as possible, letting people know there's resources available, letting people know there's a course of treatment that you can, in fact, pursue with a likelihood or a reasonable likelihood of a successful outcome. When you think about populations that are particularly at risk here in the county, how do you think about that? Like, where do you see the trends unfolding?
I would say that I don't think some of those trends are much different here than in the rest of the country.
Yeah.
I mean, I would say it's been publicized in newspaper articles that it's affecting jurisdictions where they have high unemployment rates. Well, that's not Frederick relative to others, but certainly it does impact our community. The prescribing patterns of the prescribers, physicians, nurse practitioners, that has an impact. But otherwise, we're not any different from the rest of the nation in terms of who is it impacting. It cuts across every socioeconomic level. It cuts across every race, ethnicity. It crosses gender, income levels.
And since we have you here, and these are your people, your constituents to some extent, what should they do? What should they be looking for? Family member, friend, etc. What are signs or indicators that would indicate that someone's having a problem? And what do you think the best kind of immediate advice for them to pursue if they actually are on the path or are addicted?
Yeah, so I say we have one, if I had to pick one great resource in Frederick County, it's 211. So if you dial 211, then we have folks there at Maryland 211, operated by the Mental Health Association, resources regarding health and human services that are available. And they've boosted their resources to be able to be better equipped to respond to people asking about substance abuse related resources that are in the community. And I see I only have 1 minute left. So
I have
so
very
I'd
few
say,
powers, but one of them I do have is to determine.
Excellent, excellent. So
they control everything else, but once I have the mic, I'm in control.
yeah. So if there's one thing you remember, it's 211. Now the Mental Health Association also operates the crisis line. And the Way Station provides the mobile crisis services. There's also a walk-in center, a mental health walk-in center. So I'd say what we need is we need to be able to expand the availability of crisis treatment services for persons with addictions, substance abuse. So we've got mental health, so we should build on what we are doing well, which is the mobile crisis and the 211 line.
Do you feel like you're resourcing up, or you?
Well, we would like to resource up.
Has any of the money we've appropriated in Congress, have you started to see it get down to your level?
No, maybe it's in the mail. Check might be in the mail.
Yeah.
But I think the stigma. So unfortunately, too many individuals who are struggling with addiction and too many families, even when they're in crisis, are not aware of resources being out there and also aren't comfortable asking what might be out there. So again, 211. So when people
denial's
ask
not
me,
a strategy.
that is correct.
Reach out as soon as possible, 211.
Yes, yes. And whether that's within your family to be able to talk about it, within your group of friends, and at your workplace and any organizations that you are associated with, I am sure that our anti-stigma campaign materials could be helpful. And in fact, we've got some in the back. If you see Cynthia Turrell in the very back there, she's leading out one of our local health improvement plan work groups, the work group that's focused on the priority of behavioral health. And out of the 3 goals related to behavioral health improvement, one of those is a stigma reduction effort, an education campaign. Another is improving access to services. And then the third is a detox program.
Yeah. Great. Well, thank you, Doctor. Let's hear it for Dr. Glickmeyer. So Dr. Elizabeth Lopez is our next speaker. Doctor? who joins us from Rockville. Dr. Lopez is the Deputy Director of the Substance Abuse Mental Health Services Administration, better known as?
SAMHSA.
SAMHSA. So why don't you, Doctor, tell the good people of Frederick about SAMHSA before we get into some questions.
Sure, thank
'Cause
you.
You know, they're obviously familiar with Dr. Brookmeyer, which she does, but they may not be quite as familiar with what you do.
Yes, of course. And we still have plenty of people who work for us at SAMHSA who don't even know all the acronyms in our federal office. So
Yeah, there's a lot of acronyms
There
in
are a
government.
lot of
That's-
acronyms.
You know, I first came to government in 2012, and I was like, wow, all these acronyms. I mean,
Yes, well, at the Substance Abuse and Mental Health Services Administration, or SAMHSA, we are organized by centers that focus on the spectrum of behavioral health conditions. So we have a Center for Substance Abuse Prevention, which deals with prevention overall of substance abuse issues. We have a Center for Mental Health Services, and we also have a Center for Substance Abuse Treatment. That's the center that I'm in, and I serve as a deputy. We have colleagues here. I have a couple colleagues here from SAMHSA with me who work in the Office of Communications, who do a lot of the public awareness work that you've been talking about and my colleagues here have been talking about. And within the Center for Substance Abuse Treatment, we have a division of pharmacological therapies. And that division specifically is charged with addressing the spectrum of treatment services available for people suffering with opioid-related conditions. And Spencer Clark is one of our lead subject matter experts in that division. So our agency is charged by Congress to administer the publicly funded mental health and substance abuse programs across the country. About 2/3 of our budget is based on a formula, which is typically based on the population in a state. So the Substance Abuse Block Grant, which is our biggest chunk of funds that we administer in our center, is allocated across the country to all states by a population-based formula, and those dollars pass through and go through, hopefully, several of your organizations and also several of the nonprofit organizations as well. About 1/3 of our overall budget is what we call a discretionary budget.
yeah.
So we put out announcements that respond to maybe some science that we are learning from NIDA or from Hopkins or from other organizations that have identified strategies, interventions, approaches that may be promising and show some good impact in providing services across populations where we have emerging trends. And that is often at the discretion of our
Right.
agency, but often directed by the Congress, as you know.
So let's talk about that. What are you seeing kind of as the most successful interventions, treatments, or what's coming on the horizon that might be very beneficial?
So for us, what we continue to see, and I appreciate my colleagues saying that a lot of this isn't new. There's a strong feeling of acuteness right now because of the lethality.
Yes.
But a lot of this is not new, and we have so much knowledge about what we know is effective.
Right.
Certainly medication-assisted treatment, and wrapped around with a comprehensive approach, including not just only medication that you're providing the identified client or consumer, but also a spectrum of services and recovery supports for the person to deal with psychological challenges that the issues might be navigating for them, also support for their families, support for loss of income, support for housing, support for coming back into the workforce. This whole spectrum of care, what we like to call a comprehensive spectrum of care, is really what we know is effective.
Right.
Unfortunately, and I'm sorry to interrupt
No.
you, unfortunately, I think because of some ways sometimes money comes out through states and into local communities, a organization may get a piece of the continuum of care that's essential for people who are in need of opioid use-related disorder services. And that one part of the continuum, if you think of it as a half moon, is not sufficient.
Right.
You do need to partner across the spectrum. So one of the focal points of the new initiative in the 21st Century Cures Act that was mentioned earlier, the $1 billion, is that we're asking states to propose a continuum of
Right,
care.
a kind of holistic approach.
A holistic approach
Right.
that isn't just
Well, they
one
leverage
piece.
each other.
Yes.
Right,
Yes.
because if you can prevent kind of people kind of falling back into addiction.
Of course.
Obviously, there's a huge savings associated with that. So almost an upfront surge of care around the person and the family clearly is not only right for the human being, most importantly, but it's right for the system as a whole.
Absolutely. I was talking in the back with one of the exhibitors about the importance of looking holistically at a person in need of services and including the value of everything that is around them in their experiences. Addiction is a very isolating condition, right, as I'm sure many people can attest to. And the stigma associated with it is one of the significant barriers to accessing care for a variety of reasons. Not only the individual's feeling about stigma and what the external society kind of pushes upon you as a person struggling with addiction, but also the kind of the infrastructure and systematic barriers in a system that for people who are suffering with addiction, who are trying to access care.
And the family dynamics, I mean, we were talking earlier before we came on quote stage here, if you will, about what's going on. I was referencing an article I read this weekend about what's happening in the foster care system in this country, which is just getting overwhelmed, like literally overwhelmed with kids because of the family situations. And they were talking about that dynamic in particular, and then also talking about what some of the downstream implications of that. But in this article, they talked about how, oftentimes children are reluctant to call, even if one of their family members have had an overdose, because they don't want to lose their parents. They're not thinking losing their life, they're thinking losing them from the home. But similarly, parents are reluctant to sometimes seek care because they might lose their children.
Yes, yes, of course.
And so you think of it, which is, you can understand why people feel this way. But all these kind of things are going on, which is to your point about the list. Can you talk a little about some of those dynamics?
Well, I think the point that you're making kind of brings up what I think you mentioned earlier is the importance in this particular issue with opioids and substance abuse in general is partnership with law enforcement and criminal justice. Because so many parts of our society see a tension between
Yes.
those two entities.
Not here.
And communities that are really making progress show that kind of linkage and those kind of partnerships. Forging those kinds of relationships across a continuum of care really breaks down barriers
Right.
to accessing treatment.
Well, we've put in, this situation has put an enormous burden on law enforcement in this country.
Yeah.
Right, because in a typical evening, I'm sure we could talk to our colleagues here in the police force in the city and the county, and just hear how their evenings have changed relative to what it used to be because of having to respond to these crises, which is obviously hard on them, but it also has other effects in the community because they're doing things that wasn't necessarily part of the scope of work not many years ago.
Yeah. I've had opportunities over the course of my career to do some ride-alongs with local police enforcement where they were implementing, let's say, a substance abuse or mental health, an innovative approach to addressing the needs of children in households where there's been a recent 911 call for either domestic violence or a crisis in the home. So we rode along with the police in a couple of different jurisdictions. There were about 15 in the country, with a counselor as well as a child welfare person. And then, of course, you had the law enforcement people all showed up at the same time and then did the critical follow-up and did a warm handoff with bringing the families back in after the police leave, after if somebody was arrested for whatever reason is arrested, comes back and works with the family that's still trying to stay together to ensure that everybody has a path into the most appropriate treatment.
Right. Right. It's just, I mean, the dimensions, but it sounds like the one takeaway I'm taking from your comments here, and from all your comments really, which is, it sounds like we know what to do, right? That if you actually break the treatment down, it's not that necessarily different than kind of treatment interventions we've had historically, with heroin related or otherwise. But the speed that this is unfolded, the severity and lethality of the drugs, which changes reaction times and changes the trajectory of treatment, and just the sheer volume of these kind of almost hitting at once in communities all around the country have really not only strained resources, but really do require us to think differently about intervention. We don't actually have not that you ever had the luxury of having time, you don't really have that here because you have so many cases to deal with.
Yeah, that's an excellent point. I do think that, that there are some challenges that are built into kind of a systematic barrier to the way we deploy resources. You know, so for example, talking about whether or not money has reached down to the local
Right.
level, because there's so many processes and there's so many requirements once they leave the federal government, even at the state level, and we've been talking with states a lot about that in terms of contracting requirements and, you know, what their procurement policies are, how much time that takes, and sometimes it might take a year before money that's already been allocated to a state to get down to a local jurisdiction. So we're working with states who
Right.
are developing models for circumventing all of that,
Right.
or arresting that at some level.
Right.
Some of them are bringing their local legislators together and, you know, passing, you know, proclamations that bypass some of these inadvertent barriers. I mean,
Yeah, not bad intention,
they're not
it's just
bad
the way it is,
intentions.
yeah.
They're trying to make sure that the money's being spent on
Right.
the people it needs to be
Right.
spent on.
And I assume you think the Medicaid program is an important part of this.
Yeah, absolutely.
Yeah.
Absolutely.
And I assume you'd endorse all the advice that Dr. Brookmeyer gave to the constituents here. Anything you want to add?
I think building on what I've heard from both of my colleagues here, the importance of talking out loud about what's happening in your family and in your community. And one of the most powerful things that does is give people hope. And I don't like to leave any kind of forum where I don't share that if you're not telling your own personal story, you're losing an opportunity to save somebody's life, because you don't know how that's going to reach somebody.
Right.
Everybody's story will reach somebody differently. So I encourage people to tell their stories, share their stories, talk to whoever they will listen to them, and then I encourage people to listen to people who want to tell their story. You're bearing witness to this process, and you play a critical role in that, indeed.
We're all in this together.
Yeah.
Well, thank you, Dr. Lopez. Let's hear it for Dr. Lopez. And I think your comment about personal story is a good one and a nice segue to our next guest, who we're very, very fortunate to have, the founder of the Up and Out Foundation, Frederick local, Corey Shore. Well, Corey, again, I do think Dr. Lopez kind of teed up you as our cleanup speaker here pretty well. Thank you for coming and sharing your story, which you've done repeatedly and is really animates your life in many ways. So, but for those of you who haven't heard it, would you mind sharing it with us?
So I'll do the best I can in a couple minutes. It's a lot
Again,
of...
take your time. This is one area I have
well,
control.
no, I mean, you know, it's been a process. It's been a long journey. But I think, you know, that's the biggest thing, is people sharing their other stories is what gave me hope. Because there was a, you know, 10 years ago, I was laying in a jail cell wondering, like, what I was going to make of my life. You know, and then today, you know, I'm sitting here. And it's going to be hard for me not to get emotional. Because, you know, at 5:30, I told my buddy, I said, you know, I was like, I'm going to have to take a phone call before we go in, because I have a friend who he's in treatment, and he gets out Monday. You know, and the only difference between me and him is just one bad decision. You know, I don't ever want to forget where I come from or get better than. You know, I know what it's like to be down and out. I don't like blaming people. I'm not big on blaming people and talking about the problem. I'm more about talking about the solution and the way out. And there is a way out, and I found the way out through, well, drug court. Frederick County Drug Court led me to 12-step program. You know, what got me involved in heroin was, I got prescribed prescription pain medication when I was probably about 17 years old. and I got my wisdom teeth cut out. You know what? And I don't blame that doctor at all, because to be honest with you, that doctor did not want to prescribe me another script, but somebody prepped me before I went in there on what to say. And I still remember like it was yesterday. That doctor did not want to write. Do I believe doctors overprescribe? I don't believe it. I know they do, absolutely. Yeah. But I don't blame the doctors. This isn't the doctor's fault. This isn't a law enforcement problem. This isn't a poor people's problem. This is our problem. Because if you think addiction is not your problem and in your neighborhood, you're crazy. You know, I've been dealing with this long enough where, you know, from Park Place to Park Bench, from Yale to jail. You know, it doesn't matter. It does not care what you drive or how much money you have in your bank account. It doesn't. You know, I grew up in Emmitsburg, where it was a small town. We had one stoplight. I played Little League Baseball, played on the All-Stars. I lived on a farm. You know, did I have some problems when I was, you know, younger? Yeah, I had some, you know, a couple bumps in the road. But you never would have thought that, you know, little Corey Shore, that grew up in Emmitsburg and went to a Catholic school, would be committing robberies and burglaries. And, you know, and that's what opiates does to people like me. I never woke up one morning and said, I think today I'm going to rob my mom. You know, but when you put opiates...
Just can't control it.
No. When I put opiates in me, it calls the shots.
Right.
Opiates had me violate my standards faster than I could lower them. I was raised, and when I hear how people talk about, you know, addicts or whatever you want to call them, people, it really makes me twitch, because, you know, at one time they were you know, I have a 3-year-old daughter that I love more than life itself, you know, but I know one thing that's stronger than the love that I have for my daughter, and that's addiction. Wow. And I'm glad that these doctors up here talked about addiction, and they're not just hyper-focused on heroin, because I think if we start focusing on addiction, we'll start to get a better understanding of the problem, because it's not just a heroin, it's addiction.
Period.
Yes, absolutely. You know, and Dr. Brookmeyer talked about, you know, alcohol. You know, and that's a big thing. People think if they stop opiates, they think, well, I never had a problem with alcohol. You know, I can drink, and that's what I did. And it's like switching seats on a Titanic. You know, and that's what happened. And if you learn, you have to learn. It's you know, it's like cross addiction, and I'm just substituting in, you know, one drug for another.
Right.
But you know,
so that's the demon you fight, addiction.
Absolutely.
Yeah.
Absolutely. Just because I've been sober for 9 years, but here's the thing I hear people talking about. I don't struggle day to day with my addiction. You know, there is a way out. Now, yeah. I've learned. Because I've had the opportunity to wear a lot of different hats since I've been in recovery, and I've learned to be more open-minded. But if you're struggling with recovery, you might want to try something different. Right. If you're, because you know, sometimes I hear people say relapse is a part of recovery. That's not true, and we need to stop saying that, because relapse does not have to be a part of recovery.
Your message is keep trying until you get to a true recovery.
Absolutely. I mean, you know, relapse, the definition of a relapse is when you go back to a former state.
Right.
So if you've never recovered,
right,
you've never went back to a former state.
Right.
You know, and relapse is a process. It's not an event. People
right.
don't just wake up one day and decide that they're going to get high.
Right.
So it's been a process. It has not been easy, but again, it's other people who have been down and out like me. People like me work. You know, we get better when around other people like me, if that makes sense. It's called the language of the heart. I can just reach people. I know my parents love me. I know other clinicians and people who have tried to help me. I know, but there's just something about other people in recovery
right.
That other people can't give us.
So how long did you struggle with trying to achieve recovery?
So when I was 20 years old, my father called the cops on me, which is one of the best things that he could have ever done for me. I didn't see that at the time,
sure.
but I want to make that very clear.
I'm sure you didn't see that at the time.
Yeah. But I can tell you, with people like me, we need consequences. Because I can guarantee you there's a lot of parents today that would wish their kids would be in jail instead of where they're at.
Yeah.
You know, and the cops, you know, I got in trouble. I didn't think I really had a problem then. I thought it was bad luck,
yeah.
or my dad's fault. And and I ended up, I got in trouble again. There's lots of trouble.
This was 3 years after your first exposure.
Well, at 20 years old,
Yeah.
the cops raided my dad's house. I did 18 months for that.
Yeah.
I got out. I was on the street 7 months, and then I ended up selling drugs to an undercover cop, and which, as a result, I went to prison. They gave me 12 years, and I did 5 years on that 12, and I got out, and I did a long-term treatment program. They court-ordered me to it, and I ended up leaving. I left AMA, which means against medical advice, and I went on the run. And started using again because, you know, you just don't feel anything. I was trying to drown that out. And then I eventually, which is my saving grace, and I'm very, very, very big on, is drug courts. People like me need very, very close supervision. We need close supervision, and drug courts are designed for people like me.
Right.
And they made me a believer. I tried them. I
So-
tried to cut corners, but they
They
were
got
with
you
me.
on the path to recovery.
Absolutely. In 2006, I got into drug court, and then, you know, and again, I don't believe people have to want treatment. You know, people say, oh, he don't want it. Well, how do you know? How can you measure desire? Because I never went to treatment, honestly,
Right.
because I wanted to. I didn't get in drug court because I wanted to. I didn't want to go back to prison. It doesn't take a rocket scientist. Drug court or prison, I'll take drug court. You know,
Where were you in prison?
I was in prison in Hagerstown.
Yeah.
But, you know, drug court made me a believer. They planted seeds. They led me to 12-step programs, and those people in 12-step programs just said and did things for me and made me feel that guilt and shame. Like I said, I did things out there in my active addiction that I would have put money on that I wouldn't have done. And I think a lot of people carry that guilt and shame around, and it really keeps them from getting clean. It really does. You know, I've had the opportunity to work in counseling at an inpatient place, and by sitting down and talking to those men and women,
Right.
you know, they open up to us, and they say things that they're not going to say to just everyday people.
Right.
So,
Well, God bless you.
thank you.
So tell us about the Up and Out Foundation.
So the Up and Out Foundation is something I started about, I guess about 2 or 3 years ago. I started it, originally I started it because I wanted to give back to Frederick County Drug Court.
Yeah.
They stopped giving out incentives. And you wouldn't think a $10 or $20 gift card is that big of a deal. But when I was out there from week to week, we have to report to court. And when we would go in, if we wouldn't get in trouble, or would have any sanctions or anything, they would give us a gift card for whether it was Sheets or the movies or bowling. And that's a huge deal.
Yeah.
You know, a pat on the back and saying, I'm proud of you and you're doing a good job goes a long way.
Everyone needs an attaboy.
Absolutely. It was tremendous. And when I found out drug court didn't do that anymore, I was blown. I couldn't believe it. When you graduate drug court, they gave me a watch and they gave me a set of Orioles tickets. You know, and that's the first thing I ever finished besides a jail sentence. You know, and that's one thing. We're great starters. You know, we're not the best finishers.
Yeah.
You know, and so I started this foundation to raise money to give back to Frederick County Drug Court, and it's just it's grown into something I never would have imagined. You know, we do graduations, we provide watches, we provide tickets to Orioles games. You know, it's just grown a lot. We do all types. The gentleman that actually called me at 5:30, we paid his full 28 days to go through treatment because he wasn't able to get into treatment because of his insurance. We help pay for people's Vivitrol shot, their copay. We do a lot of different things.
Yeah.
You know, I spoke at Catoctin High School last year, and a young lady came up to me afterwards and shared a little bit about her story, and I took it back to our board, and it crushed me because both of her parents and brother was caught up in addiction, and she was living with another family. So we went out and bought her a whole bunch of stuff and took it to the school for Christmas. You know, so we just try to give back to a community that, you know, that I took so much from.
And you know what works.
Absolutely.
Corey, thank you.
Thank you.
So, wasn't that great? Yeah. So we have a bunch of questions from the audience here. It's funny, the first one is, can a person addicted to heroin ever be completely recovered and free of the addiction? I think we just got the answer to that. so we don't need that one. So I'm going to go through these questions, and I'll just, if there's someone in particular I think has some insight into this, I might direct it. Otherwise, I'll leave it open. I think this first one, how will the new health care bill affect those suffering from addiction?
Sure.
Doctor, I think
So,
this is, you have a subspecialty from, I remember looking at your bio and the intersection of, I think, healthcare insurance and healthcare policy, so this is probably right up your alley.
Yeah, and, so I spend my life living at 30,000 feet, and it's always good to get down on the ground and talk about how these issues really play out. So the new healthcare bill, and I assume the question is about the legislation that's been proposed in the U.S. Senate, although they're not calling it a bill. We know it's a bill, and we know that they're going to try to move it through. Essentially, what it would do is dramatically change the way the Medicaid program operates. And for those of you who don't know about Medicaid, Medicaid is basically the lifeline that provides insurance coverage for folks with low income. The Medicaid program is the #1 provider of drug and alcohol treatment in the United States. It finances a lot of needed support. It's also one of the main ways that we can pay for the medications that are effective for substance use disorder treatment, as well as a lot of the wraparound services that Dr. Lopez was talking about. So any policy that would do what this bill does, which is essentially to reduce the amount of money that the federal government is authorized to give to the states for Medicaid by capping it, the rate of growth, in a way that is not sustainable, is going to leave states holding the bag. And we know in the sort of the long history of how drug and alcohol treatment gets paid for, that when the burden of this falls on the states have to find ways to sort of either cut corners or not give services to people. So I frankly think that it's very devastating. One thing you may hear is that there's something in the legislation that's being put in specifically for the opioid epidemic. The money that they're saying they might put into it is anywhere from $2 billion to $40 billion. Now that sounds like a lot of money, but when you look at the amount of money that is trying to offset in terms of cuts to populations with opioid use disorder, it really doesn't even come close to making up the shortfall. So for those people who feel motivated to do things that are going to be impactful for this community, I would really encourage you to make calls to people on the Hill this week. I know that you can attest to the fact that when the phones ring, people in the House and Senate listen.
Absolutely.
And and if you know folks in West Virginia is a really critical state. So I would just really encourage everybody to pay very close attention to what's happening on this.
Thank you, Doctor. So the next question is about how religious and faith communities, which I know have been very engaged in this struggle, how they can assist in addressing this. And I assume that's both structurally with programs they have, but also in terms of helping people just through their faith working through these issues. So I don't know who has a perspective on that.
Yeah, well, SAMHSA and some of our other operating division partners has a strong history of funding and supporting faith-based and community-based organizations. We had an initiative that was probably in effect for more than 5 or 6 years, as some of you may be familiar with, Access to Recovery, which focused on supporting the wraparound services that we've been talking about, principally through providing resources to faith-based communities and faith-based organizations that historically hadn't been receiving service dollars for the provision of that continuum of care that we've been talking about here. So the non-traditional services that maybe aren't in a doctor's office or a clinical social worker's office, but the person who's going to help you navigate a relationship with how do you get the child custody back, or how do you make sure you have vouchers to get your self or your family member on a bus to a health appointment or to school. A lot of the community and faith-based organizations really help do that.
Yeah, good.
And if I can add, so
Sure.
in Frederick County, many of the houses of worship do make space available in their buildings for groups to meet, and also our recovery center. In Frederick County, we have 2 formal recovery centers. One is at the All Saints Episcopal Church downtown, And so I'd say the faith-based communities have expressed an interest and have provided support. And I'd say that we would like to be able to support them even more by establishing peer support programs. I'm sure that every house of worship has at least one person, if not more, persons who would be willing to break through the stigma and start helping others in their community. And so from the health department, while we have 2 formal programs, we've written 2 proposals so far that haven't been funded, but to be able to help support peer-led recovery support programs outside of those 2 established bricks and mortar locations that we have, so that more people can benefit from peer-led recovery support services, which include all of the areas that my colleagues up here have talked about, which are so essential. You know, whether that's housing, whether that's how to get from here to there, support with, whether that's legal support, so a variety of support. So we'd really like to be able to have a greater network of individuals who are committed to helping within their parishes. And so whether that's also connected with the parish nurse program or through Frederick Memorial Hospital, their Bridges program, they've been training individuals that aren't necessarily nurses, but lay health professionals to go back to their parishes and provide some education. So I think we have a foundation that we can really build on and be able to provide support in a community that's a little more comfortable for some folks.
Thank you. Yeah, please, Corey.
You know, there's a program here in Frederick called, what she mentioned, at Centennial United Methodist Church, 2nd Street and Hope. And they play a vital part in me being here today because they give out, they used to give out, they serve meals there to the homeless. You know, and the fact of the matter is, one time in my life I was homeless. You know, I was walking around in Frederick trying to find a place to go, and you know, I knew that they opened their doors. I knew they gave out free Domino's pizza, and I'm like, oh, I'm there. You know, and it's funny, but something, again, it falls back even on those gift cards. You know, but free Domino's pizza is what reeled me into that church, and because of them, you know, I owe a great debt to them. And now we actually go there and serve meals. The Up and Out Foundation, we go there and serve. You know, serve to give back to the homeless. So those churches, those local organizations, they're vital in our communities.
So the next question is about someone writes that their husband has been dealing with pain issues for 25 years. Sounds like been dealing with it successfully, but now they're having a hard time getting access to medicine, which you could see how that dynamic might play out. So it's kind of the other side of the coin here. Doctor, you probably have a view on that, either or two.
Sure. Dr. Lopez, do you want to start?
No, please.
Okay. This is unfortunately a story that we're hearing more of, is that well-intentioned efforts to reduce the spigot for people who might misuse drugs are also reducing access to drugs that people need, and that there is an appropriate role for opioid pain relievers when they're appropriately managed. And for some patients, they really are good medicine. So, you know, I don't think that this is, I couldn't sit here today and tell you this is exactly the right policy that's going to strike that balance. Yeah. But I think that it takes a lot of care and it takes a lot of oversight. And as I said in my earlier remarks, it also takes thinking about access to non-medication treatments that are very effective that some insurance companies don't necessarily want to pay for. That there are things that help people to manage chronic pain that aren't just medications, even though medications can be useful.
Right. Dr. Brookmeyer, someone writes that as a high school teacher, what can they do to help the children of addicted parents? Any insights there?
Oh, well, certainly being aware, well, first being attuned to the fact that there are students that you will come in contact with that is their circumstance and their families. So one, that's first recognizing the potential. Then number two is identifying what resources might be available. So within the school setting, so there are the, you know, besides the administrative folks and the principal, but then there's also the counseling system that's available in the health room. We've got folks, and then branching outside of the school. But so I would expect that they would be great resources depending upon which school. You might also have CAS workers or other folks who are connected to the community. I understand that the Asian American Center of Frederick is developing a community health worker to assist with students in some of the schools and make the connections back to the community and support the families' various needs in navigating the health system. So being aware of the supports available, the Kids Like Us program, so specifically the Kids Like Us program, we've just expanded to a few more schools in Frederick County, so I encourage you to contact us at the health department to identify if a Kids Like Us program is there. And so it's a support program for students who have family members who are who've had issues with addiction, and to reach out, because there are folks who are knowledgeable. It's unfortunate that not everybody in this room can spout off 4 or 5 places to go. And so, again, if I can say one, so 211 is a good place to start. But since you're in a school system, the various folks in the schools have spent a lot of time to try to identify what is available for students and to be able to build on the strength of the community support that the school can provide. So then if there's homelessness, then the SHIP program. So there are a variety of ways to go, but I would start within your system and to look up the Kids Like Us program. We've been going through a rigorous evaluation method for the last 8 years or so. We're hopefully going to soon have enough students who have participated so that the research can be completed to demonstrate or to communicate that that program is effective at meeting its outcomes, that the Kids Like Us program is effective at reducing student substance use disorder, keeping the students in school, helping with their grades, so a variety of outcomes that are of interest to our whole community, but certainly to the families and to the individuals. So we're really excited about the Kids Like Us program, soon to be completing its evaluation phase.
Thank you, Doctor. Dr. Lopez, someone writes, wondering what can be done to help babies born with addictions to opioids.
Yeah, that's a great question. Protecting Our Infants Act has been an activity that SAMHSA, along with our partners at the Administration for Children and Families, have been involved with in identifying evidence-based practices, again, holistically in working with women even before they're pregnant, but then women when they are pregnant, and then when children are born, evidence-based practices across the continuum of care for this population of women. And we just recently released and provided a report to Congress addressing the spectrum of evidence-based practices associated with Protecting Our Infants Act. So if you stop by our resource table, I'm sure we can get you information on how to get access to that from our website.
Great. Sure. Yeah, please.
I just want to briefly say that I think the best way to help infants is to help their mothers.
Yeah.
And that, we're hearing a lot in the news about something called neonatal abstinence syndrome. That is an important issue, but we need to think about it sort of in the broader context of how to help that child. And the best way to help that child is to help that child's mother. And the best way to help that child's mother is to make sure that that child's mother has the treatment that she needs to be a successful parent. And there are effective ways to help babies that are born with this condition. It's not at all meaning that the baby's going to have a lifelong addiction. These babies can grow up and be very successful and healthy.
So, Corey, one of the audience members writes, wondering what they can do in terms of volunteer work to help others. That seems like it's right up your alley.
Well, there's a lot of organizations out there that do volunteer work. For instance, I talked about Second Street and Hope.
Yep.
You can sign up there. Anybody can go there and feed the homeless. There's just something in giving back. You don't have to be in recovery to give back. I believe helping others is what keeps us clean, what keeps me clean. But we're always looking for people. We have a lot of events coming up. We have the Run for Recovery coming up in August. After that, we have something going on at FCC. We have Chris Herron, who used to play for the Boston Celtics. We have him coming to speak. And then in the end of the month of September, we have a big volleyball tournament coming up where we have the guy Brandon Novak, who used to play on the show Jackass on MTV, who is in recovery, and he's coming to share his story at our volleyball tournament. So you can check our website out. We're always looking for people to. There's power in our stories. Right. And we're looking for even family members. Like, I don't know what it's like to lose a child. I don't know what it's like to be on the other side, but that's how there's a lot of support groups popping up for family members, because you all can help each other more than somebody who doesn't understand. So, yeah.
Great.
Yeah, so I'd like to add, so we're definitely interested in expanding our peer recovery supports that are available in the community to developing a program of parents helping parents in response to what Corey has suggested.
And they can come to your office for that?
Yeah, so on the Frederick County Health Department website under Substance Abuse Treatment Services, there's information there under recovery about how to find out how to become a volunteer. And we sponsor peer recovery coach academies. And at no cost, it's 36 hours, and it's for individuals who have lived experience personally or as a family member. And then in addition to the Recovery Coach Academy, then for individuals interested in continuing on, then we offer a RAP program, the wellness something, or yes. So, but we would like to begin to be able to provide more supports to parents out there, and so a Parents Helping Parents.
Great.
Again, like Corey had said, that they're in the best position.
Yep.
They've been there.
So the next question, I'll just open it up and see who feels like they've got the best insight into it. It says, a lot of money has been focused on the opioid crisis. What are we doing to educate families and younger children for the purpose of prevention? Good questions tonight, aren't they?
Well, I'll start, but I think everybody can add to this. So from the federal level, as I mentioned, we have a Center for Substance Abuse Prevention that is receiving resources appropriated by Congress to explicitly focus on the prevention of substance abuse. At the moment, of course, we're focused on opioids, and in that spectrum of work, there's initiatives that focus on campaigns related to talking about substances with your children in kind of your regular, ordinary activities, like sitting down at the dinner table and starting a conversation. Talk, they'll listen is one of our campaign mottos, and one of our models that we use to walk through parents having conversations. We role model with parents of when to have a conversation with your children, what to start to say to your children in order to break through kind of that barrier of kids who don't want to talk to their parents. How do you start having conversations with your children about drugs even before you start to see any evidence or symptoms of that? So we have lots of resources at the federal level that's focusing on that. We have drug-free community initiatives across the country, over 800 community local grants that are working with local small organizations principally. Many of them are faith-based organizations and community-based organizations working to develop small, local, strategic approaches to the prevention of substance abuse.
Yeah, I think that the materials that you mentioned, so it used to be Partnership for a Drug-Free America, but it has that new name now. What is that? So the
Strategic Prevention Framework?
Oh, no, but the materials that are age-based prevention messages, so the booklets that are for, children who are 0 to 3 or 0 to 5. So it's parents. So it's
So tools for parents.
Yes.
Yeah.
So, sorry, I can't remember the exact name now.
It's another acronym.
The organization has changed their name, but so the materials that they have, and I'll have to see, one of the folks who was here from the DEA before had all those materials. And so, like you said, so depending upon the developmental stage of the child, it begins, so if a child is taking, if you're providing a medicine for the child who has a fever, then you're saying, okay, so this is the medicine because you have the fever, this is what you're taking it for. We don't take the medicine unless we have a reason to be taking it. I also caution everybody to think about, when you mentioned adults, the children are watching what we do.
Right.
You know, that's always, we might try to say, what is it, do as I say, not as I do, but if you think about how you talk about drugs or alcohol, and so I'll specifically mention alcohol because I hear it most often, something like, oh, I really need a drink. And I hear that often when there are also children around who are hearing that. So if we try to think a little bit more about what are our words saying, as well as what we're doing.
Yeah, thank you.
I want to say, I think something that's important is, again, people sharing their stories. And we came out with a Running for Recovery video about 3 years ago. And when that video hit YouTube, I couldn't believe the overwhelming response that we got from it. I wasn't expecting that. I just wanted to kind of share my life with other people.
Right.
In the first week, it was downloaded thousands of times. And I actually had to shut down my social media because I didn't know how to handle all the parents reaching out to us. So I think getting those educational tools out in schools, you know, getting out, people want to hear from people who have lived experience, who lived it and made a way out. You know, Conrad Weaver's here, and I have to give, you know, he's filming a very, very crucial documentary, and it's called Heroin's Grip. And it's gonna be the good, the bad, and the ugly. And I always say that because there's going to be some raw stuff on this video that needs to be seen. And that's the stuff that people don't like to talk about, but people that aren't in addiction, they don't understand the degradation. You know, they don't understand what we put ourselves through. So those type of tools are vital for getting in schools and parents, you know, seeing and hearing that stuff.
Well, you know, when you listen to all the collective comments here, it's this interesting intersection between kind of research, evidence-based, clinically oriented approaches and kind of genuine, authentic people who have experienced it. Kind of those collective set of resources converging together seems to create successful outcomes, right? Because people, like, you put up a YouTube video and it may be what makes people feel, that may be the first thing that makes them feel safe talking about it, right?
Hope.
You know, it gives them some hope. And then they get in the system, as we talked about, there are proven ways of dealing with this. But part of it is overcoming the stigmas, getting people engaged, getting the fear out of it, the embarrassment, the shame, go down the list of reasons why people don't do it. So it's a funny kind of intersection of resources that you need to really tackle this thing.
I mentioned
kind
this,
of
but
bottoms up, top, you know.
I work with Dr. Brookmeyer. I mean, I have 6 felonies, and I work in the same parole and probation office that I used to report to. You know, so I say, is that odd or is that God? You know, and the Frederick County Health Department is the one that made that possible. I figure, you know what, I'll apply for the position, and it can't hurt to try. And I am so grateful to be a part of that team because we're doing, you know, there's a lot of resources in Frederick County. The Frederick County Health Department is doing a lot. But to be able to work in the parole and probation office that I used to come up through the elevator in shackles in, it's unreal. You know, I get a lot of people referred to me through probation who think they have a felony and they think their life is over. And I think if you go case search me, you know, you're going to think I'm a horrible person because we do judge a book by its cover. You know, and we need to, it's 2017, and if you're an employer, I encourage you, please give people a second chance. You know, everybody's got a backstory. Yep. Everybody's got a backstory, and my record is directly because of my addiction.
I want to thank everyone who joined us this evening. I want to in particular thank our 4 guests. I want to thank everyone who asked questions. You know, let's keep the conversation going. Let's keep the dialogue going. But thank you all for joining us.